Now talking about the forensic interview itself, what is the focus then? The focus is on, again, the legal proceedings and not on the therapeutic goals. The focus is not giving treatment, but on what the legal implications are. There is no therapist-patient relationship here. Rather, it's an evaluator-evaluee relationship, which means that unlike normal principles of confidentiality, privacy, this relationship has very limited confidentiality, as all information, reports, assessments would be submitted to court and to other relevant authorities. And often the evaluee or the accused is not participating out of his free will. Sometimes they want to hide, they want to malinger things or their behavior, so they have some sort of coercive participation in forensic interview. Despite that, in India, because of lack of resources, sometimes both the teams are same. You also have to treat the patient as well as evaluate their roles in terms of the legal issues they were facing. Besides, here documentation is not just for the purpose of diagnosis and treatment, but serves a legal use. Hence, documentation becomes very much important. What is the difference from the usual psychiatric interview? The patient has a limited choice. Patients will often be resistive and try to deceive the evaluator. The crimes that the accused might reveal can take an emotional toll on the evaluator, particularly when dealing with perpetrators of sexual abuse, of murder, of other criminal activities. So it can take an emotional toll, and we can develop a strong counter-transference against the person. And that is why flexibility and resilience is needed. We need to change our methods frequently so that deception is identified. Timing should be flexible. Different phase of interviewing should be used and should be resilient to whatever information or whatever threats that the patient might put forth.